Picture this. You're in a pediatric exam room, your toddler's swinging their feet off the table, and you're just hoping the ear infection clears before the weekend. Routine stuff. But behind the computer screen, the doctor makes one small click. So small you don't even notice. And that click quietly doubles as a built-in quit smoking coach for you. Wild, right? I'm Dewspin, and today we're unpacking how a single, automated tweak inside a children's hospital's electronic record nudged real parents, people like you and me, toward a smoke-free life. Section 1. The Rumor Mill. First, let's rewind to the whispers in the hallway. Nurses kept hearing the same surprise confession. "Hey, I haven't bought a pack in weeks." Another parent showed up smelling like, well, nothing. No cigarette odor at all. There was no billboard campaign, no extra clinic visits, no stern lectures. It felt like a tailwind, gentle but definitely there. So people started asking, is this real, or is the universe just flipping a few lucky coins? Section 2. Turning stories into numbers. Stories are great, but medicine lives on data. So the Children's Hospital of Philadelphia, CHOP for short, dug into its electronic health record, the EHR. Key move number 1. They followed parents for a full year and checked lab markers that prove whether someone's still smoking. The result? Parents who passed through the automated pathway were 3.9 percentage points more likely to be smoke-free, climbing from under 1 in 10 to roughly 1 in 7. That's a 41% relative jump. Translate that nationally, and each single percent rise keeps about 15,000 kids away from secondhand smoke. Do the math on 3.9%, and you're clearing the air in hundreds of thousands of living rooms and minivans. Section 3. So what actually changed? Now here's the meat part. What didn't change? Doctors didn't get longer visits. Parents weren't scheduled for extra counseling. Instead, the visit they were already having quietly sprouted 3 new branches. Branch 1. The EHR prompted the clinician with a 30-second evidence-based script. No improv needed. Branch 2. With 2 clicks, an e-prescription for nicotine replacement therapy landed at the family's usual pharmacy. Branch 3. An electronic referral to more quit resources. On the caregiver's side, that felt like real concrete help. Not, hey, maybe think about quitting, but here's your patch, it's waiting at CVS. Section 4. Why clinicians liked it. You might assume docs groaned about yet another pop-up. Surprisingly, the opposite happened. The template shaved documentation time and structured decisions, freeing clinicians to focus on the human stuff. How's daycare handling the asthma? What's your plan for cravings on the night shift? Automation didn't replace relationships, it protected them. Section 5. The price tag. Let's talk money. Early analysis pegs the cost per extra successful quitter at under $600. If you've ever priced one ER visit for a wheezing kid, you know that's a bargain. Still, CHOP's team is careful. Different hospitals, different math. Replication is the next stop. Section 6. A shift in perspective. Traditionally, smoking cessation lives in adult clinics. Think heart attacks and lung cancer. CHOP flipped the script. They framed quitting as pediatric preventive care. If a smoke-free home means fewer ear infections or asthma flares, why wouldn't a children's hospital lead that charge? That reframing opened the door to use pediatric infrastructure, EHR workflows, visit schedules, the whole team, to reach adults who rarely see their own doctor. Section 7. Can we rinse and repeat? Once the data started rolling in, a new question bubbled up. Where else could invisible assistants help? Asthma action plans auto-assembled? Postpartum depression screens that instantly tee up counseling? Food insecurity flags that populate community pantry referrals? The principle is the same. Decide in advance what matters, have the system notice it, and serve the right help right when it's needed. Think of a restaurant kitchen. The chef isn't hunting for salt. It's already by the stove. Good EHR design is clinical mise en place. Everything in its place so humans can actually cook. Section 8. Looking forward. Imagine expanding the network, linking pharmacy data, text reminders, maybe even community organizations, so support follows families after they walk out the clinic door. Like smart traffic lights smoothing out a busy intersection, you're not adding more rules. You're simply timing the green lights so the safe route is also the easy route. Exceptional recap. So, here's what we covered today. Let's land the plane. 1. A single EHR tweak, one extra click, turned ordinary pediatric visits into built-in quit smoking interventions. 2. That tweak boosted verified quit rates from about 9% to roughly 14%, a 41% leap that could clear secondhand smoke from hundreds of thousands of kids' homes if scaled nationwide. 3. The secret sauce was automation serving up ready-made advice, prescriptions, and referrals while giving clinicians more face time, not less. 4. At under $600 per extra quitter, the economics look promising, though replication will tell the full story. 5. Most important, this isn't just about smoking. It's a blueprint. Decide what matters, whether that's asthma meds, food security, or mental health. Bake the help into the workflow, and let the system do the nudging. Empowerment close. Quick thought experiment before we go. If your phone pinged you at your 3 toughest craving times tomorrow, after meals, on the drive home, and right before bed, what message would actually make you pause? Write it down. Make it real. Because whether it's an EHR click or a text on your lock screen, tiny nudges add up. And the next healthy habit that sticks? It might start with the smallest automation you almost didn't see. Let that sink in for a second.